monoclonal antibodies are a treatment that can be given under two conditions. So to individuals that are COVID positive within 10 days of having symptoms that are high risk for hospitalization or death from the virus, or also to people that are unvaccinated that have been exposed in close contact with the virus. They can receive treatment if they're in a high-risk group as well. The medication's been heavily researched. It's a medication that can be given here in our clinic, and effectively what it does is it binds to the virus, to the spike protein on the virus, and it prevents the virus from getting into the cells within the body. So it has to be given very early on in the course of the disease, waiting till you're hospitalized, oxygen levels are dropping, or until you get really sick. It's too late for the medication to work effectively. This is the first full clinic that we have here at the medical center. It's the first state-sponsored clinic in Riverside County. It's been built in partnership with the Public Health Department, our Emergency Management Department, and our state Cal EMS authority. And the goal is to get people treated the same day or within the next day or two. The treatment itself takes about 30 minutes, and then there's about an hour of observation period. So all told, it's about a 2-hour process from the time that you arrive to the time that you go home receiving the treatment. The most eligible individuals would be ones that have symptoms for less than 10 days, have tested positive for COVID, and have any of these, so that have obesity, chronic kidney disease, diabetes, that are pregnant, immunosuppressed, or receiving immunosuppressive medication, or anyone over the age of 65, or anyone over the age of 55 that has cardiovascular disease or high blood pressure. It can be a PCR test or an antigen test. And then similarly, if you're in one of those high-risk groups and you've been exposed, we usually think of an indoor exposure for more than 15 minutes with somebody that's tested positive for the virus, that you would be eligible for the treatment even without a positive test, just based upon your exposure. We welcome patients or medical professionals. Either one can call directly to schedule an appointment. That appointment number is 951-486-6520. There's somebody available from 8 a.m. to 6 p.m. to answer that line. If they don't answer, please leave your name and a good contact number, and they will get back to you to get you scheduled as quickly as possible. The vaccine is still our best tool in fighting the spread and complications relating to the virus. So we continue to really encourage people, particularly those high-risk individuals, to get vaccinated. But this is certainly another tool that we can use early on to prevent hospitalizations and complications related to the virus.